Respiratory examination. Inspection. Observe the hands looking for any signs of cyanosis, tar staining that may indicate smoking, or any skin changes, such as bruising or thinning of the skin can be associated with long-term steroid use. Palmar erythema could be a sign of anemia. Also look for any signs of joint swelling or deformity, as it may be associated with rheumatoid arthritis. Look for signs of finger clubbing known as Shamroth's window, which can be a sign of CO2 retention. Additionally, look for any signs of a fine tremor, which could be down to overuse of inhaler, or a flapping tremor known as asterisk, which could be another sign of CO2 retention. Assess the patient's pulse for up to 1 minute. Inspect the eyes for signs relevant to the respiratory system for things such as conjunctival pallor, suggestive of underlying anemia. Ask the patient to gently pull down their lower eyelid to allow you to inspect the conjunctiva. Also check the mouth for any central cyanosis, bluish discoloration of the lips and/or the tongue associated with hypoxemia. Assess the JVP, as it provides an indirect measure of central venous pressure. Position the patient in a semi-recumbent position at 45 degrees. Ask the patient to turn their head slightly to the left. Inspect the chest wall for any deformities or scars, such as a median sternotomy scar or axillary, thoracotomy scar, along with any signs of a pacemaker or chest drain. Inspect for evidence of chest wall deformities, such as asymmetrical movement typically associated with pneumonectomy, lung cancer. Pigeon chest, also known as pectus carinatum, or funnel chest, also known as pectus excavatum, or barrel chest, also known as hyperexpansion. It's also important to check cervical neck glands, as if they are swollen, it can often be caused by common illnesses like colds, tonsillitis, and ear or throat infections. Abnormalities is characterized by how they can feel hard or do not move when you press them. Swelling in the cervical lymph nodes may indicate a problem in the head, neck, throat, or lymphatic system. Palpation. Palpate the chest by placing your hands on the patient's chest, inferior to the nipples. Wrap your fingers around either side of the chest. Bring your thumbs together in the midline so that they touch. Ask the patient to take a deep breath in. Observe the movement of your thumbs. In healthy individuals, they should move symmetrically upwards, outwards, during inspiration and expiration. Vocal fremitus is a vibration transmitted through the body. It refers to the assessment of the lungs by either the vibration intensity felt on the chest wall, tactile fremitus, and/or heard by a stethoscope on the chest wall with certain spoken words, vocal resonance, such as 99 and/or blue balloons. Percussion. Percussion is primarily used to detect underlying consolidation, starting at the supraclavicular region, also known as the lung apices, moving to the infraclavicular region, followed by 3 to 4 regions of the chest wall and the axilla, comparing side to side as you progress. Noting any sounds that is resonant, which is a normal finding. Hyperresonance, the opposite of dullness, suggestive of decreased tissue density, such as pneumothorax. Dullness suggests increased tissue density, such as consolidation or a tumor. Stony dullness, typically caused by an underlying pleural effusion. Auscultation. Auscultation of the lungs help diagnose respiratory pathologies. Repeat on back. With the patient still sitting forwards, ask them to fold their arms across their chest so that their hands are touching the opposite shoulder. This results in rotation of the scapula, which moves it laterally, increasing exposure of the underlying chest wall for assessment. Assess the posterior chest, including inspection, chest expansion, percussion, and auscultation. The final steps. Assess for evidence of pitting sacral edema, which could indicate a long congestive heart failure along with crackles on auscultation. Also look for signs of pitting pedal edema, which could indicate right ventricular heart failure. Assess for any signs of deep vein thrombosis, which could be indicative or lead to a pulmonary embolism. Subscribe to the channel for more.